Debriefing. Many argue this is when the most learning actually takes place. But ever wonder the best way to debrief a clinical encounter with your learner? Hi, I'm Amy Gardner, Associate Dean for Faculty Development and Director of the Academy of Medical Educators here at the University of Colorado School of Medicine. Today I'm delighted to introduce you to Gabrielle Whitmore, Assistant Professor of Obstetrics and Gynecology here in the School of Medicine. Hear from Dr. Whitmore on how she approaches debriefing clinical encounters with her learners to ensure smooth and effective conversation.
Imagine this. You've just observed a learner try something new and noticed a few areas in which they can improve for next time. Maybe you're in clinic, in the hospital, or a simulated environment. Regardless of the setting, it's our job to step in and help guide the learner towards improvement. Debriefing is one tool that makes this possible. Hi, I'm Gabrielle Whitmore, a minimally invasive gynecology surgeon and an assistant professor here at the University of Colorado School of Medicine. I've been using debriefing in my teaching practice for years, and I'm so excited to share with you some of the techniques that make it such a successful teaching tool. Debriefings are facilitated conversations. They follow a specific event to aim towards improvement in future performance. They're an important strategy for learning about making improvements in individual, team, or system performance. The goals of debriefing are to 1. Discuss the actions and thoughts processes involved in a particular clinical situation. 2. Encourage reflection. And 3. Incorporate improvement towards future performance. Sound complicated? It doesn't have to be. Scholars have put together frameworks for helping facilitate these important debriefing conversations, one of the most straightforward of which is the advocacy/inquiry approach. In the advocacy-inquiry approach, advocacy refers to the statement of one's views, and inquiry refers to the process of asking questions related to the view to facilitate the conversation. The advocacy-inquiry approach can easily be incorporated by using the following 3 prompts to facilitate a conversation with the learner. I saw, I think, I wonder. Here's an example. Imagine you observed a learner obtain initial history from a patient without making any eye contact, only looking at their checklist and writing down their notes quickly. We've all been there. Using the advocacy-inquiry approach, you might pull them aside afterwards and begin debriefing this conversation like this. I saw you diligently working through the checklist to ensure you're collecting all the necessary patient information. I think this initial interaction is an important time for us to develop rapport with our new patients. I wonder, what additional things could you do to ensure your patient feels heard and supported during this initial encounter? As you can see, this approach allows for a balance of inquiry, discussion, and mutual learning. I saw, I think, I wonder. Using the advocacy-inquiry approach, you can help your learners reflect on past experiences as a source of new learning and transformation. This simple and effective teaching tool can be completed in 5-10 minutes max immediately after a clinical encounter to improve both individual and team performance. But don't take my word for it. Try it for yourself today.